What happens if you wake up during surgery? Waking up during surgery, a phenomenon known medically as intraoperative awareness, is one of those hidden fears most people rarely voice out loud. As patients, we surrender our consciousness and control to the anesthesiologist, trusting them to shield us from pain and memory through the intricate weave of science and care. But what if, in the midst of an operation, something goes awry? What if consciousness flickers back to life before the surgery is over, and the sterile world of the operating room rushes in too soon? Here is a comprehensive exploration of what happens if you wake up during surgery, why it occurs, what you might experience, the science behind anesthesia, the emotional aftermath, and how modern medicine strives to keep this rare event from occurring. To answer this question, one must first understand the nature of anesthesia. The very word anesthesia comes from Greek, meaning without sensation. And since the mid-19th century, it has become an essential, invisible shield for patients undergoing surgery. The purpose of general anesthesia is to render you unconscious, cut off your awareness, and completely eliminate pain so that surgeons can perform procedures otherwise unimaginable. Yet, as precise as medical science strives to be, the human body is complex. Anesthetic depth is not simply a toggle switch that you flip off and on. Rather, it's more like navigating a dimmer. Adjust too little, and the patient may feel sensation or consciousness. Too much, and there could be adverse effects on vital organs. Striking the optimal balance is an immense responsibility, one that relies on individualized assessment, vigilant monitoring, and rapidly responding to the body's constant feedback. So, what exactly is intraoperative awareness? Technically, it's the unintended experience of consciousness and recollection during surgery under general anesthesia. It is estimated to occur in about 1 to 2 out of every 1,000 general anesthetics, although the risk can be higher in certain surgical situations, such as emergency trauma operations, cesarean sections, and cardiac or other high-risk surgeries where lighter anesthesia may be necessary due to underlying health conditions. Simple surgeries with healthy patients and robust monitoring have a much lower risk. But what actually happens if you wake during surgery? The experience can vary dramatically. There are 3 core components involved: explicit awareness, the recall of events while under supposed anesthesia, sensations from feeling pressure, touch, or pain, and the emotional reaction to these perceptions, such as panic or helplessness. Most commonly, patients who experience intraoperative awareness report simple auditory sensations, overhearing voices, the clink of instruments, or the beeping of monitoring equipment. Some recall pressure or the vague feeling of movement. Far less frequently, true pain is experienced. When it does occur, it can be excruciating and distressing in memory. Some patients wake up and are unable to move or speak, caught in a limbo known as anesthesia awareness with paralysis. This frightening variant happens because muscle relaxants are often used during surgery to keep the body still and the tissues easy to operate on. These drugs paralyze all voluntary muscles, rendering the patient incapable of movement or communication, even if they regain consciousness. The sensation is described as being trapped inside your own body, fully aware of your surroundings, but unable to alert the surgical team, a truly nightmarish scenario. Imagine for a moment, you are lying on the operating table. Your eyelids are heavy, your body feels leaden. There's the distant echo of voices, someone calling out a medication dose, the rhythm of machines. Suddenly, you realize you're not asleep anymore. You try to speak, to move, to signal your awareness, but nothing happens. A weight presses down on your chest. You hear, and perhaps even feel, what's happening, but you are utterly powerless to act. For the small number who experience pain, it is often reported as a searing, strange ache or a sharp horror, impossible to put into words. In such situations, the mind races. Some patients report a surge of panic, confusion, or even dissociation, where the mind tries to protect itself by distancing from the present. Others report a hyper-focused clarity, piecing together snippets of conversation, or visualizing what they cannot see. The psychological imprint of these moments can be deep and enduring. What leads to anesthesia awareness in the first place? Several factors contribute. First, the methodology of anesthetic administration is variable. Each patient's physiology is different. Weight, age, metabolic rate, coexisting medical conditions, chronic medication use, history of substance abuse, and even genetic factors can influence the individual's response to drugs. Alcohol and certain prescription medications, for instance, can raise your tolerance to anesthetics. Second, some surgeries require a lighter plane of anesthesia. This is often the case for patients with underlying health issues, such as advanced heart or lung disease, where deeper anesthesia might endanger basic bodily functions. Certain emergency and trauma operations may also run this risk, as the patient may not have been fasted beforehand. Increasing the risk of breathing problems or rapid decision-making is required, precluding a thorough pre-anesthetic assessment. Third, equipment malfunction or human error plays a role. If an intravenous IV line becomes dislodged, if an anesthesia machine fails, or if drug dosages are miscalculated or misadministered, the intended protection may fall away. Thankfully, such technical errors are rare in modern, well-run hospitals. To monitor depth of anesthesia, practitioners typically rely on several external signs: heart rate, blood pressure, sweating, movement, and increasingly, brain activity monitoring tools like the bispectral index (BIS) monitor, which translates electrical brain waves into a number reflecting consciousness. But no method is perfect. The body's stress responses may be blunted by medications. The equipment may not pick up subtle transitions between consciousness and unconsciousness, or an idiosyncratic patient response may catch providers off guard. For patients, the aftermath of intraoperative awareness can be as devastating as the event itself. Studies show that up to half of people who experience significant intraoperative awareness, especially episodes involving pain or paralysis, develop lasting psychological consequences. The most recognized is post-traumatic stress disorder, or PTSD. Symptoms may include nightmares, flashbacks, anxiety, sleep disturbances, depression, avoidance of medical care, and hypervigilance. The trauma is sometimes compounded by disbelief or minimization by medical professionals, making healing even harder. In attempts to alleviate these burdens, many hospitals now have protocols for counseling patients who report intraoperative awareness. Early acknowledgement of the event, validation of the patient's experience, and referral to specialized psychological support are now considered best practices. But anesthesia science is not standing still. Over decades, advances in both technique and technology have made anesthesia vastly safer. Modern anesthesiologists undergo years of rigorous training, perfecting the delicate art of matching sedation depth to the precise needs of the patient and type of surgery. Tools like depth of anesthesia monitoring, more nuanced drug delivery systems, and improved screening for risk factors all help minimize the chances of awareness. If you have a particular fear of anesthesia or a history of awareness, telling your anesthesiologist is critically important. There are strategies for minimizing risk. These may include the use of additional sedative medications, close monitoring with BIS or other devices, or altering the choice and dosage of anesthetic agents. Your voice is an important safeguard in your care. So, what should you actually expect if the rare event of waking up during surgery does happen? Depending on the depth and type of awareness, you may recall vague impressions or very specific sensations or emotions. Many patients experience only brief or fragmented recall, stray noises or blurry images with no sense of confusion or fear. For these, the event is often brushed aside without lasting harm. If you experience pain or paralysis, however, it's more likely to be seared into memory. After surgery, a sense of relief that it's over may mingle with anxiety, disbelief, or anger. It is common for people to question whether what they remember was a dream, a hallucination, or reality. Surgical teams should be trained to listen non-judgmentally to these reports, investigate thoroughly, and offer reassurance and support. In the rare but risky scenario where the patient cannot move but is fully conscious, sometimes referred to as locked-in awareness, the effects may linger. These patients may later describe feelings of isolation and terror, an acute sense of helplessness, Again, psychological support is vital. To minimize risk, ponder some essentials before undergoing surgery requiring anesthesia. Always be open and honest about your medical history, any prior difficulty with anesthesia, substance use, or health concerns. Communicate your fears. Fasting before scheduled surgery should be taken seriously. Bring a list of your regular medications. Ask your anesthesia team what safeguards will be in place. This collaborative approach strengthens your safety net. If you are a loved one supporting someone going into surgery, know that intraoperative awareness is rare, and significant pain during surgery is even more so. But if concerns arise after an operation, if strange, distressing memories, nightmares, or new anxieties linger, encourage the patient to discuss these candidly with their healthcare providers. Psychological healing is an important part of recovery for a small subset of people. Medical researchers continue to push the boundaries of what we understand about consciousness and anesthesia. Some are studying personalized anesthetic regimens tailored to a patient's unique genetic and physiological profile. Others are developing monitoring tools that can more precisely measure the moment-to-moment ebb and flow of awareness. In the future, we may achieve anesthesia that is as close to foolproof as medicine allows. For now, awareness during surgery is an infrequent but not unheard of event. It is shaped by many factors: anatomy, drugs, technology, vigilance, circumstance, and luck. Yet the system is designed with redundancy, multiple levels of protection to shield the vast majority of patients. The stories of those who have experienced intraoperative awareness serve as an important reminder that even in an age of medical miracles, vigilance, compassion, and respect for the patient's lived experience remain at the heart of healing. Imagine waking from surgery, confused by a memory that seems out of place, a doctor's conversation, the cold metal of an instrument, the brilliant illumination above the field. For many, these fragments fade, harmless into the background of post-operative haze. For others, the memory is persistent, insistent, frightening in its clarity. The response of those around you, do they listen, take you seriously, help you make sense of what happened, can profoundly influence your path to recovery. In modern medicine, validating and supporting the patient's experience is as crucial as perfecting the science that underpins their care. If you are about to enter surgery and find yourself anxious about anesthesia and awareness, take comfort in the vast majority of successful, uneventful anesthetic experiences. Your safety is the priority of the team around you. They monitor, adjust, and stand ready. Still, your questions deserve answers, and your fears deserve respect. Medicine today aims not only to prevent pain and memory during surgery, but to respond with empathy and skill if rare complications occur. For the medical professionals, anesthesia remains one of the ultimate acts of trust, invisible, essential, life-altering. Each case is a reminder of the balance between science and humanity. For patients, knowledge is power. Understanding the realities and the myths around intraoperative awareness equips you to be a better advocate for your own well-being, before, during, and after surgery. In summary, if you wake up during surgery, it may mean you have become consciously aware of your environment, sounds, sensations, and possibly even pain while under intended anesthesia. It may be as benign as fleeting auditory impressions, or as distressing as full awareness combined with paralysis. Risk factors include lighter anesthesia for high-risk procedures, medical errors, individual resistance to drugs, or physiological differences. The event is rare, but its psychological impact can be significant and enduring. Modern medicine employs rigorous safeguards to prevent it, and honest communication with your healthcare team is an important layer of protection. Should it occur, early acknowledgement and psychological support are key. Ultimately, understanding, prevention, and compassionate recovery are the pillars of care. With every advance in medicine, the focus moves not just to the science behind anesthesia, but to the deeply human experience of regaining consciousness, and, if necessary, helping people heal from the uninvited memories that sometimes follow. Thank you for watching the video. What do you think about today's topic? Feel free to share your thoughts in the comments below. If you enjoyed it, don't forget to like and share the video to support the channel. Thanks again, and see you in the next video.